Welcome back to Rare Connection, the podcast dedicated to bridging the gap between rare disease awareness, education, and access to treatment. I'm your host, Joanna. And today we have a truly exceptional guest whose work embodies the very essence of our mission. We're joined by Khartik Uppalapati, a young visionary who is not only a groundbreaking biomedical researcher, but also a passionate advocate and co-founder of the RareGen Youth Network. Khartik's story is one of profound personal experience, driving powerful systemic change, facing his own challenges, and with arteriovenous malformation, a rare lymphatic disorder. He has transformed his firsthand knowledge into a relentless pursuit of innovation and advocacy, from pioneering research into organoid intelligence and biological computing to championing equitable healthcare access to digital health protections. Khartik is at the forefront of a movement that's reshaping the landscape of rare disease care. His work at the intersection of science, policy, and youth activism is nothing short of inspiring. He's not just conducting research, he's translating it into tangible impact, engaging with hundreds of families, publishing critical policy reports, and collaborating with international groups to ensure rare disease patients are represented on a global scale. Today, we'll delve into Khartik's fascinating research, explore the groundbreaking work of RareGen, and discuss his visionary his vision for the future, where science and advocacy converge to create real lasting change. Join me as we connect with Khartik Uppalapati, a young leader providing. So, Khartik, can your personal experience with rare conditions has clearly fueled your passion. Can you share more about this specific moments or challenges that solidified your commitment to this work?
Yeah, so unlike a lot of other disease individuals, like people with rare diseases, mine came about fairly late into my life, around the start of the COVID pandemic, or when I was around, 12 or 13 years old. So it was a really big shock because, overnight there's a lot of things that just collapse. You can't do anymore, like physical activities, for example. So it was a really big shock. And, there wasn't a lot of support groups. There's a lot of stigma around rare diseases. So it's very difficult to navigate. Um, and then I learned about these patient advocacy groups such as the PFIC network and LERN, which works for lymphatic disorders. And I attended a conference for the PFIC network where I actually presented my research to the University of Cincinnati. And when I was at the conference, I saw all these scientists, they were like 60, 70 years old. And all the discussion was really centered around them and their work. And same thing goes for the advocates as well. They're all really late into their lives, into their careers. But then I was thinking, rare disease patients, most of them are adolescents. So why don't adolescents have a voice in rare disease policy and how we tackle rare diseases and how we make progress on this issue? So that's when I started RareGen because I wanted to close that gap between, youth driving policy that impacts them directly and creating mechanisms for rare disease like youth with rare diseases to get involved in the space. So that was really the pivotal point, going to that conference and actually seeing the disparity between, the people making decisions for the youth and then, the youth's involvement themselves.
What was the genesis of RareGen Youth Network? What gaps did you identify that you felt needed to be addressed?
Yeah, so like, immediately off the bat, the main thing is that the experience shared between people with different rare diseases is very similar, even though obviously, there's a lot of like differences in medication, treatment plans, severity of the rare disease. But the general challenges we face, like the structural barriers, are in like something that we have in common between all rare diseases. And I noticed that, a lot of the action was being consolidated into like specific disease focused groups instead of one big network for everyone to drive, changes that affect all rare diseases. So I wanted to fill that gap, and I created RareGen as an organization for people with all kinds of rare diseases to come together and advocate for the policy that affects us, the science that affects us, and the research that affects us as well. So this is not meant to take take charge over existing patient advocacy groups, but it's meant to supplement the work that these individualized, focused groups are doing with a broader sort of advocacy, if that makes sense. And the way I formed RareGen was I actually met a bunch of patient advocates at the PFIC conference that I mentioned earlier. And I also reached out to a bunch of advocates in the local DC area where I'm from. And I noticed that, a lot of people wanted to take action, but they didn't have any outlets to do so. They didn't have any opportunities. So it was that sort of initial kind of point where I realized that there's a problem to be addressed, which is youth involvement, and there's no mechanism for this to take place. So RareGen's to kind of formed to fill in that gap, if that makes sense.
You're balancing cutting edge research with advocacy. How do you manage to juggle these demanding roles, and how do they inform each other?
So I think the unique part about being involved in both advocacy and science is that they go hand in hand together. Pretty sure that's like without a question, I think we can all agree on that. So I feel that in order to inform ourselves as change makers on what the best course of action is, we have to know about the current developments in science, what's going on, how we can best see its advocacy, because what we're advocating for is really technical from a scientific perspective. So being an informed researcher helps me keep up to date with the latest developments, what we need at a ground level, if there's any like new discoveries that we can translate to help patients increase their quality of life, getting that brought to them, So it really helps you get a deeper understanding of what exactly rare disease patients need and what the current scenario is like from a treatment perspective, for example. Because the interesting part about policy is that we don't just advocate for um, the science, like the treatments, we also advocate for issues which will still continue to exist even with treatment. So bridging both of those together is really unique, something you can only do with knowing the science as a researcher.
Organoid intelligence is a fascinating field. Can you explain in simpler terms what it is and the potential impact of rare diseases?
Yeah, so organoid intelligence is really unique because currently we have artificial intelligence systems, which, they're computational based, they don't have any biological elements in them, they're linear, they're static, and we use these to inform decisions and to learn behaviors over time. That's the principle by which AI operates. But the issue is the learning mechanisms in this AI, it's not so dynamic like the human brain. So it can't replace the way that our brain makes decisions. What organoids are, they're miniature brains. They're derived from stem cells. They operate very similar to how brains operate and they learn how brains learn. So unlike AI, when we're training them to learn specific behaviors or work with data, they can think in the way humans think through a process called neuroplasticity. So it's more dynamic, it's more adaptable, and it requires less data to inform us, which really takes the challenge out of rare diseases in particular. Because for rare disease research, we don't have much data when we're building AI models. But if you use organoid intelligence, you don't need that much data because the inherent complexity of how the brain works, of how organoids work, makes it so that they can gain a lot of information with less data compared to AI, for example. So that really revolutionizes the possibilities for what we can do with organoid intelligence technologies for rare diseases, almost like a substitute for AI.
Your work with AI is tracking protein changes and skeletal age is impressive. How do you see AI and machine learning revolutionizing rare disease diagnostic treatments?
So a big part about rare diseases is that we don't have much data on how they operate, but AI is still very useful for rare diseases because with the limited data we have, we can build more specific models and models that use like advanced augmentation process to generate more data for informed decisions, and we can find patterns across rare diseases, which help us, monitor treatments or extrapolate the findings of one rare disease to another closely related rare disease so that we get more information for how healthcare providers can address the issues that rare disease patients face. I think this is particularly useful because there's a lot of diseases, like especially for the bigger ones, doctors like your common general practice doctor might know how to treat strep, for example. But if you're talking about like a specific rare disease that they've never encountered before, it might be a little bit harder for them to navigate because that's not something they're specifically trained on. So having AI helps the doctors use a knowledge base that they can reference later on. And that really helps streamline the diagnosis process or the prognosis process because like speaking from my experience, I had to go to 8 different doctors just to get a diagnosis of what rare disease I had or even what was causing my symptoms. So if we have AI tools, we can streamline that process because doctors have better knowledge bases. And they don't have to, go out there and do hours and hours and hours of research just to get inconclusive results or findings.
Stay with us. We'll be right back.
Do you want to know what it's really like to have a C-section? I'm Dr. Jen, an obstetric anesthesiologist.
And I'm Bethany, a nurse and a birth educator.
This is the C-Section Experience podcast, where we support you in preparing for and processing your C-section journey through education, validation, and storytelling. We're here to reduce anxiety, amplify your voice, and help you feel truly seen.
As friends and fellow C-section mamas, we're on a mission to empower you. Through personal stories and expert guests, we'll laugh, we'll cry, feel all the feels, so you can approach your birth with confidence.
I wonder why they don't do that in the medical fields right now.
Yeah.
Because it's taking 70 years to diagnose somebody. And oftentimes we get misdiagnosis.
Yeah.
Can you elaborate on your research into antimicrobial ligens and the use of high performance computing?
Yeah. So, as a rare disease advocate, I've noticed that a lot of rare diseases are bacterial in nature. And that's really important because nowadays, especially with global warming and with a lot of pathogens just appearing, there's a lot of different possibilities for these rare diseases to break out and not become so rare anymore, become more common diseases, which we don't want because then more people will be affected by them. So what I've been doing is I've been creating AI models to discover new drugs to target these bacterial rare diseases. For example, like really rare strains of Mycobacterium tuberculosis that are currently contained but have the potential to outbreak because now they're resistant. They're not responding well to existing medications. So I'm using AI to discover new drugs to target these resistant strains of rare bacterial diseases. And the way I'm doing this is through high performance computing, which is basically like an accelerated computing unit. It's a supercomputer. So if it took us 10 days previously to use AI because of how complex and energy intensive it is to discover one successful drug, it might take us 1 day or 2 days now. So I'm taking advantage of these supercomputers to accelerate this rare bacterial disease drug discovery.
So what are the potential implications of the work for rare disease patients, and who are often immunocompromised?
Yeah, so a really big part about high performance computing, like these supercomputers, when you integrate it into drug discovery pipelines, is that because it takes less time to find drugs, you also have time to test more drugs. And what that means is that you can profile the drugs that you find and conduct like toxicity testing, simulated testing, like on how to respond in the body. You can even synthesize them like through multiple stages to see how they respond. So you can guarantee that the drug you're finding is the best drug for those who have pre-existing side conditions. This has always been a focus, not just for rare disease patients, but for everyone in general, because being immunocompromised, that also happens especially in other populations, such as those who have other disabilities, or especially the elderly, or those who have been exposed to like pollutants in the air, for example. So our interest in making drugs is to make sure that it's suitable for everyone. So these high performance computing technologies allow us to take more time and verify that these drugs won't have any adverse side effects because it takes less time to find one. So we have more revisions, if that makes sense.
Mhm. So your paper on machine learning derived biocomputation and for antibiotic discovery is intriguing. What inspired you to pursue the specific area, and what are the next steps for this research?
So earlier this year, I was at the United Nations Summit of the Future, where I met a lot of biomedical researchers as well as members of the United Nations Antimicrobial Resistance Committee as part of the WHO. So when I was there and I was talking to them, I realized that, although people traditionally associate antimicrobial disease resistance with large diseases like tuberculosis or Klebsiella pneumoniae, there's a lot of other diseases that are also bacterial in nature, and antimicrobial resistance doesn't just affect the big ones. So my goal is to work on these really small diseases, these small rare diseases, and I noticed that machine learning was the best way to deal with them because these small rare diseases, they oftentimes don't have much training data. So being the first ones to create machine learning models, especially effective machine learning models, really helps set a precedent for future research. Because if no one's going to work on it, then we just won't have progress in this field. So my inspiration was just like hoping to be the first one to take initiative and the first one to set a precedent for using machine learning or just targeting rare bacterial diseases in general because they go completely overlooked right now.
So what are the health hurdles? What are the largest hurdles overcome when conducting research with rare diseases?
The biggest hurdle by far is just collecting data because rare diseases are rare, so not that many people report enough data for us to find. But in general, even if everyone did report all their data, it would still be hard to analyze and make significant trends because the maximum amount of data we can have is limited. So working with low amounts of data to make highly conclusive results is a really big challenge. But over time, we've learned to use more efficient models that don't rely as much on having loads of data, which ties back into organoid intelligence, which doesn't need that much data. So our the biggest challenge has been being able to get over that hurdle and to still get conclusive results with whatever resources we have.
RareGen has engaged with over 500 families. What are some of the most common challenges they face, and uh, how is RareGen addressing them?
So especially because we're members of the youth, like we're a youth focused organization, and we try to stay that way, like exclusively youth focused. A lot of the issues in the quality of life sphere uh, tend to end up sort of relating to education and education barriers, whilst for other rare disease populations, just like older populations, uh, financial debt or like unemployment might be a really big issue due to discrimination or unfair practices by insurers. But amongst the youth, education is really our biggest issue. getting schools to recognize these rare diseases, understand their impact, grant special waivers or accommodations. It's really hard, especially when, schools often don't have the resources or the training, or they just refuse to put in the time to help accommodate students with rare diseases. So a lot of what we've been doing is we've been creating a mechanism for students to follow across the country to request, special accommodations for their rare diseases, or communicate the specific implications of what they have and how it affects their learning. Because, I'm sure a lot of people with rare diseases would know sometimes it's not really obvious how our rare diseases affect us, but they really do affect us and they really do make a big impact. So restricting our access to the resources we need is very unfair. So, focusing on education, that's the biggest challenge that a lot of our families see right now.
You published several reports on healthcare and environmental policy. What are the key takeaways from these reports, especially concerning rare disease patients?
One of the biggest concerns right now is, like financial allocation and dealing with insurers and lobbyists, because these insurers are trying to increase the medical debt that rare disease patients have to pay. They're also trying to reduce the amount of options they have to find alternative drugs, biosimilars or generic drugs. So the real battle right now is going on in the rare disease policy sphere is, combating these predatory insurers. And that's like across the globe. We've done a lot of international advocacy as well as domestic advocacy, and across all of the different sort of reports we've written, analyses we've written, testimonies we've given, the main issue is targeting these insurers and making sure that, our rights are advocated for, our interests are represented, and that people know that, we're important to not only like the insurer's profit. So that's one of the biggest issues that rare disease patients are currently faced with from the policy angle, that, politicians have an opportunity to fix and advocates have an opportunity to advocate for.
Digital health protections are crucial. Can you explain the importance of fair access to medical data and stronger privacy measures for rare
Yeah,
disease?
so digital health is really important, especially because there's a lot of lack of access to in-person healthcare services or in-person healthcare monitoring. Because, rare diseases especially have a lot of disabilities. Sometimes they go hand in hand, especially physical disabilities, which inhibit our ability to, go to medical centers and ask for assistance. So having telehealth options is very important. And then also digital monitoring of our data is really crucial, because unlike other patient groups, our data makes almost a tenfold larger impact than other groups when it's used in the right way, because there's a lower saturation of the amount of people who have rare diseases. So ensuring that, this digital health ecosystem becomes more sustainable and more reliable in the future directly impacts the outcomes that these rare disease patients face. And when it comes to privacy concerns, ensuring that our data isn't misused is really important, because, like, again, there's a lower amount of rare disease data, so there's a lot of incentives for, people who want to abuse data to uh, sort of take our data and not have any concern to privacy. So while yes, it's important for people to have access to rare disease data, it's also important that, patient privacy isn't infringed upon, and there should be no reason it's infringed upon, because it's an essential right that every patient has.
How does RareGen collaborate with international policy groups? And what are some of the global challenges in rare disease advocacy?
So, RareGen has gone to like multiple summits and conferences through the UN. We've spoken at many. We've been to the World Bank as well, WHO. So we've been to all these platforms. We've spoken or we attended lectures, for example, and we've gotten to network with a lot of the speakers as well, and as well as like government officials and policymakers. And we've really introduced like the impact that um rare diseases have on the youth, and brought it to like the spotlight of these policymakers, so they can make more informed decisions and prioritize our issues. Because right now, honestly, if you go to like most conferences, you won't see many youth advocating for rare diseases. So getting our voice heard and like reaffirming that, okay, we exist, we have problems that need to be fixed, and you guys are critical stakeholders in fixing our problems, helps them get to the spotlight and helps them get solved faster. One way we've been doing this is through Rare Disease International, which is one of the biggest coalitions of rare disease organizations in the world. And they have established international contacts. So we've been working with them to see how we can get involved in their process, and work with them to introduce sort of youth angle to rare diseases. So that's where our international advocacy has taken us so far.
Mhm. Your advocate, you advocate for equitable healthcare access for biopic youth with disabilities. What are the specific barriers they face, and what solutions are you proposing?
So, those sort of communities are already disadvantaged when it comes to healthcare access. So when they have rare diseases, it makes it even worse for them to get access to, equitable services, for example. And oftentimes there's not much of a focus on their specific needs when it comes to rare disease advocacy. So putting a spotlight on, sub communities within the rare disease community really helps their stories come to light, and it helps others learn about what challenges are being faced and how to best solve them. So what RareGen has been doing is we've been identifying sub communities within the rare disease space to see who we can best affect and who we can best bring their story to the spotlight for better access to healthcare, highlighting the inequities that they face and bring forward some change that hasn't been there so far, even just acknowledgement of the issue.
What success has RareGen had in influencing policy?
Yeah, so recently we advocated for a couple of bills in Maryland. In the state Senate, we advocated for a medical debt protection bill, and then we also advocated for a bill that allows for, diversity requirements in Maryland to be instated to allow people with rare diseases and disabilities to have better representation on state councils. And both of these laws have been voted for are about to be voted for. We haven't had any actionable news on them so far, but the votes will happen sometime this week, and then we'll get to know what happened to the bill. But when we were actually testifying, the senators were really moved by the simple 2-minute speech we gave, because that brought down all of the efforts from lobbyists, anti-rare disease advocates, because of how personal and how emotional our speech was. So, making a difference in policy has been something that we've been doing for a long time, and seeing it translate to specific laws or specific stakeholders taking our requests seriously has really been great to witness. And we hope that we can also influence other similar bills that target rare disease patients to take down the bad incentives of people who are working against the incentives of people with rare diseases.
What's the one thing you would like policymakers to know about rare disease?
So I'd like policymakers to know that even though a lot of their constituents might not have rare diseases, the impacts are really severe. And we shouldn't just be prioritizing issues based off of the sheer amount of people who have them. We should be prioritizing them off the severity and off of the impact they have, because everyone deserves to have their problems heard, their problems solved, and their problems acknowledged. So at least listening to your constituents with rare diseases and understanding their inequities they face is a really good first step. And then getting involved with other civil society organizations or non-governmental organizations such as RareGen or NORD, or Rare Disease International, for example, is a really great step towards getting actionable measures taken to solve the inequities of the rare disease community. Because, we've already laid out really good plans to help reduce inequities, but they haven't been acted on because there's not much interest. So, taking our requests seriously is a really good step towards achieving a better future.
You envision a future where more biological computing transforms medicine. What are your long-term goals in this field, and what breakthroughs do you hope to see?
So because of my really unique background in both patient advocacy and science sphere, I hope to lead my own team embarking on research in this biological computing field to further rare disease research, and then also working with legislators and lawmakers to bring these findings and translate them to actionable uh, treatments for rare disease patients or actionable tools to be used by those involved with increasing the quality of life for rare disease patients. So I hope to be involved both with non-governmental organizations as well as research institutes in a capacity that serves both the patients directly and helps accelerate research.
What advice do you have for other researchers and advocates who want to make a difference in the rare disease community?
So I'd say that there's a lot of buzzwords, there's a lot of technology going around nowadays, both in advocacy and in research. And it might be tempting to fall in line with those buzzwords and abandon like true goal of helping rare disease patients. But I'd say that solutions should be focused on the patients itself, get active feedback from the patients, and figure out what their user needs are when you're making either decisions as an advocate or a policymaker, or doing research as a scientist, and figure out what they need best, not just what would benefit you. Because at the end of the day, if we're making discoveries and they don't translate to any real actionable tools that can be used by rare disease patients, then there's no point really. It just doesn't benefit the people who's intended to benefit. So working more closely with rare disease patients is something I would advise all researchers and all advocates to do.
How do you measure the impact of RareGen's work, and what are your goals for the future of the organization?
Yeah, so every year we put out an annual report that can be accessed on our website at raregen.org. And we really just work with our chapter leads to figure out what kind of projects they've done, take attendance of how many people are at their events, and then just be really, really responsive to us whenever we ask for statistics on how many people they've impacted. So we have a grassroots sort of data collection mechanism. And in the future, we hope to expand our reach to identifying more subcommunities within the rare disease space, youth rare disease space, and helping them. And we also hope to expand our chapters internationally so we can have a larger impact beyond, the United States, Canada, and our Qatar chapter.
What's some of the biggest misconceptions about rare diseases, and what would you like to address?
So, a lot of people assume that rare diseases are this small thing that doesn't really affect anyone. But if you look at it worldwide, there's hundreds of thousands of people who have rare diseases. So even though, yes, individually a singular rare disease might be small, collectively as a whole, rare diseases aren't that small. So, when you're taking steps towards addressing rare diseases, you're not just impacting a couple thousand people. It's oftentimes like 100,000 times more of an impact than what you're thinking it is. So prioritizing issues of the rare disease community is a really constructive step towards ensuring, the essential quality of life and rights of a lot of people around the world. And it's something that everyone, not just people with rare diseases, should prioritize and work on.
What is your call to action for the listeners of this podcast?
I would say go out there, find your nearest RareGen chapter or, rare disease advocacy organization chapter, and find a way to get involved. For example, for RareGen, we're having an event in mid-April on April 20th, where we're hosting an ostomy bag drive in Fairfax, Virginia. So if you're interested in that, you can contact us on our website, and we'll be putting up a Google form as well to sign up in a couple of days. Just get involved with your nearest rare disease advocacy organization and see what you can do. Even if you volunteer for 10-15 minutes, it makes a really big impact because, we don't have that many people who are allies of the rare disease community, for example. So we really have to rely on a limited amount of resources. So any help we get is really appreciated.
Yeah, I just got back from an Every Life Foundation thing, and it's a couple weeks ago for Rare Disease Week, and it's huge. How many
Was it
people?
Capitol Hill?
Yeah, Capitol Hill. It's how many people they pull in every year. Been doing it for a long time, but the past 3 years I've been going in person, and it's amazing to see how many people are actually there.
Yeah, I was going to go this year actually. I think one of our members went. They met like the Virginia like congressional office, like people for our senators. But I wasn't able to go because I had a test the same day. But yeah, I was really looking forward to because DC is really close to me. I'm in the DC metro area, so it's like a really exciting opportunity to get involved.
I go every year, but it's let's see. And let's see, that brings us to the end of our incredibly insightful conversation with Khartik Uppalapati. Pronouncing that right.
Yeah.
Khartik, thank you so much for sharing your groundbreaking work and your unwavering dedication to the rare disease community. Your passion and drive are truly inspiring, and we're so grateful for your time today. To our listeners and viewers, I hope you have been moved by and informed by this discussion, as I have. Khartik's work reminds us the change is possible, and that even the most complex challenges can be addressed with innovation and advocacy. Please remember to subscribe to my YouTube channel, Rare Chef, for cooking and lifestyle content. And of course, subscribe to my podcast, Rare Connection, wherever wherever you get your podcasts. We are on a mission to bring the stories and insights that matter to improve the rare disease community. You can also stay connected with RareGen, with Rare Connection on Facebook, X, and LinkedIn. Where we share updates, resources, and engage with our community. There is a Facebook group and a Facebook page. Finally, if you or someone you know is struggling with mental health issues, please know that you are not alone. There is help available. You can call the Suicide and Crisis Lifeline at 988. You can also text them that way. The crisis text line text home to 741-741 from anywhere in the U.S. anytime about any type of crisis. Remember, your life is valuable, and help is just a call away. Thank you for joining us, and we'll see you next time on Rare Connection.